Hi, everyone, and welcome back to another episode of Public Health Career Conversations. I am delighted to have with me today Dr. Kibachio Joseph Mwangi. Joseph is a medical doctor who is now at the World Health Organization in South Africa in the role of medical officer and advisor for non-communicable diseases and mental health. So, Joe, thank you so much for joining us today. I really, really appreciate it.
Thank you for having me.
So there's very specific reasons that I've asked you to join us today. I think you've had a journey that is not unlike many others in South Africa, started off in another country, in another field within medicine. I thought it would be really great to hear from you around what your journey has been. And a lot of colleagues, some of the questions are around how do you get into public health? What are some of the decisions that someone has taken? How do you decide whether to, move context, etc.? So I think if we could start there, maybe, take us through what were some of the thinking and the decisions that you had to grapple with when you were deciding whether to pursue public health as a career.
Okay, thanks, Atia, and it's always nice to see you. Always great to chat with you, and thanks for the many times that we've worked together with the Department of Health and WHO, and it's good to have colleagues and networks like you within the public health space, and I'll be talking about it, the value of networks later during the talk. And again, this will probably just sound as a story, telling my story, which exactly is, because sometimes when we talk about career choices, we become too scripted and we become too, formal, and we just want to hear a human story. And I guess there's nothing more I can say apart from just tell my story. So I think public health is a thing that is very dear to me. And on another level, one day probably we may have a discussion, because the field of public health is very interesting. It's grown. While we were in medical school, we just had clinical practice and public health. So there were very good divide. Today, you don't even know whether you are practicing international health, whether you're practicing public health, whether you're practicing global health, whether you're public. There are many, many small little niches within it. And that whole space so has become even broader. So, for example, my PhD is in global health. I consider myself a practitioner of global health, but within the bigger ambit of public health. So as you asked, my journey with public health is from when I was a small boy. I mean, I consider my story to have started then. Then I went to a school, from primary school, secondary school. I was not in a very rich background. I was from a poor background. Although they say once you are 30 years old, you cannot continue saying I'm from a poor background. You are the background now. My children look up to me and continue saying I'm from a poor background. But nevertheless, I went to school with people's donations, the Save the Children Fund. There was a school called Starehe in Nairobi, which is a school for the poor, but a school that builds you in an whole-rounded kind of manner. And they put a lot of service in the education. Part of the curriculum, you have to go and work in the community during school holidays. And so my service to community started opening up then. Then I went to a university in Kenya called Moi University. That at that time, there were only two medical schools in Nairobi. There was Nairobi University Medical School, and there was Moi University. Moi University was started with a community-based approach. And we would be teased and be called community doctors, at that time. And well, because a lot of our service was in the communities, serving the 80% of the population who did not have clinical doctors to serve them. And so my engagement with the community started from an early time, and then I became a doctor, and I'm sent to a town called Embu, and I loved clinical work. Any doctor remembers their days when you ask all those questions, and old mamas come and they bless you, and there's a lot of happy memories of me being in clinical practice. Then I was sent by the Ministry of Health in Nairobi to serve as a clinical manager in a refugee hospital that was in the Kenya-South Sudan border. There was war in South Sudan. So I joined the UNHCR as a seconded medical officer from the Ministry of Health to work in the refugee camp. So my job, my mandate was confined to four walls. I'm just sitting and prescribing. Then there was a cholera outbreak in that town called Turkana. It's a very remote, very poor, war-ravaged town. And the worst thing was that my mandate was just to see one patient at a time. And I saw this gentleman who came with cholera, almost died. We did what we did, he walked away home. 3-4 days later, the gentleman comes back, but with his wife and children, they also have cholera. And a question I was like, okay, I can sit here and treat one person at a time, or I think there's a calling for me out there to go and stop that cholera. So my starting with public health started at that time, and that I felt there's, you know the narrative of the one tree and the forest. I can sit here and see one tree at a time, but I think I can sort out this problem once and for all, because the gentleman lost his child, and it was sad for me, because I was like, he probably didn't need to. There was some public health. You see, health works on two limbs. There's a clinical limb that I was working on, and that was sorted out. We could do anything. But there was a public health limb that was out there, the prevention, the promotion, that I felt we failed this gentleman. He didn't need to be in the hospital in the first place, especially after having cholera. He was a person who needed, anyway, that's a long story. But at the same time, I was doing a master's in public health at that time. I had a lot of time. When you're working in the refugee camp, the day starts at 9 and ends at 3. It's a security zone. So I had the whole night. And I decided to enroll with the University of London. The London School of Hygiene and Tropical Medicine has an external program, a master's program in public health, distant learning. And that was my beginning with books. And so they would send you by DHL like 30 kilos of books. And I'm in this report town, and I would read. And a few of my colleagues would not understand, hey, what's wrong with you guys? You probably need to enjoy yourself while you're here. But anyway, long story short, I started my career into public health, and slowly, when I finished that master's, I think I really love reading. I enrolled in another master's, this time in epidemiology. There's a program called the Field Epidemiology and Lab Training Program. I don't know, I'm sure you know it at here in South Africa. So the Kenyan Field Lab and Training Program is under the CDC. It's a beautiful program on field epidemiology, pushes you right into the deep end of field epi. So I became this field epidemiologist. And the one point of departure, I think I like, define the beaten path. The FELTI program mostly looks at infectious diseases. If you've engaged with them, their origin is, it's a military wing in the US. The EIS program is a military, and it's to, for global security, is to look at diseases that can have the potential of crippling nations or spreading globally. So most of their residents are looking at cholera, Rift Valley fever, aflatoxins, and I decided, I think I have a passion for diabetes and for NCDs. And the program was not fitting very well. Because even when you're learning epidemiology, there's an epidemiological triangle, the host, the environment, and the vector. But in NCDs, those things don't fit in, and I really struggled. But I had great mentors at that time. There's a gentleman called Dr. Omolo Jarrell, who, very great gentleman, who works in Botswana now, and pushed me on to become an NCD epidemiologist, as you would say. There were a few guys who just did epidemiologists. So I got myself into the field of epidemiology, and when I get to the ministry, I was given the chance to head the NCD docket in the Ministry of Health in Kenya. And my boy, did I take it with gusto. And the passion almost finished me, and I loved that space. So there was clinical practice in it, but because you're talking about diseases like diabetes, hypertension, cancers. But then much of my job now was policy. So to my epidemiology, again, you add policy work. You've worked at policy level, and there is now another layer that has been put, which is like politics, not the kind of ANC, the politic, no, but the politic of dealing with government, understanding how resources work, understanding how policy work. So I honed my skills there. And by the time I was leaving government, I was promoted one time to be the head of a department they called the Strategic Programs Department. So they put together the HIV, TB, malaria, and the vaccine program, and they called it the Strategic National Public Health Programs. It was a huge program. I was, very blessed and lucky to head this program. And while there, again, that bag of one tree and the forest again started attacking me. And the WHO I had a friend in the WHO called Dr. Shongwe, a great guy that time, who kept telling me, Joseph, every time we meet, I think you should be working for the WHO. And I didn't imagine it was time to leave. I had a young wife, I had a young family, and I'm like, oh my goodness, this international life might be very disruptive. But finally, because again, politics became very heated up in my country, ideally the civil service is usually very shielded from politics. in the ideal setting. But in that time, we had the turmoil in my country and the civil service became very polarized and it wasn't a good environment at that time for me to work. And this is a personal view. So I decided, hey, it's time to go into WHO. So finally, I joined WHO. And in that same time, I was also doing my PhD again with the University of Geneva, this time in global health. While in government in Kenya, I was very lucky again. And I must say, luck is probably not the word. I will give you a few tips when I'm talking about public health because you have to put yourself out there. Luck goes to the bold. I don't think everybody can talk about luck. Luck is a word we use for lack of how to describe it, but you have to be bold and be out there. Then you meet with the opportunities. Then, for lack of a better word, we call it luck. But I had the advantage of representing my country in the World Health Assembly, and that's how I got to know the WHO proper. So for many years, like for 7 years, every May, I was in the delegation, of the Kenyan delegation, to represent my country in the World Health Assembly. That's the premier meeting where resolutions of WHO are made, great decisions globally are made. And I loved it because it entailed a lot of reading, a lot of packaging things in a political language, a lot of horse trading, because when you go to deal with another country wants this, you want this, so you agree on this, you cut here, a resolution is a negotiated decision in public health. And so for 7 years, 8 years, I represented the country on tobacco control, on obesity, on sugar, I was very lucky. It was at the time when the SDGs were being negotiated. And again, I found myself there. And in the process, I got an award, a UN award for SDGs in the NCD space for making sure that these SDGs are, seeing the light of day. And so it has shaped my career, having worked with the WHO, but not being in WHO, being from my member states. And that's a very lucky space, again, I would say. And that has shaped my wanting to join the WHO. So later we will be talking about the money versus the career, the local versus the international, the small niche versus the broad niche. So I can say that has been my journey. It's a journey that still is going on. I love working for the WHO currently. I don't know how long I'll be here before that bug bites me again. But for now, I'm here. I'm advising the South African government on NCDs and mental health, which is a huge problem here in South Africa. But I love working with the Department of Health. They're great guys out there, as you know, and they are short-staffed. So I sometimes hold myself as part of the department to help to bolster the capacity at the Department of Health.
Thank you, Joe. And thank you for telling your story from the beginning. I think, as you say, sometimes we tell the sanitized version of how we get here. But I think, I think people who are watching this will probably resonate with, at least something within your journey, because whether it's the rationale around, why you went into public health, or even just, your background and the education that you received. I do want to say it's interesting to hear that there was the university that you studied at had quite a focus on community health. I think that's quite different from many institutions where a lot of the focus is clinical care, curative care, and not so much the public health aspects of it. And I just to anyone who is watching, I think Joe studied his MPH sitting in a refugee camp with having books sent to him. And I think nowadays there's plenty of online resources. So you really can, find the resources, find the time to at least get some skills in public health, even if you cannot get into an undergraduate, a postgraduate formal training. But Joe, before we go into the WHO work that you do, I just wanted to ask you to maybe elaborate a bit more about field epi, because we haven't come across it. Obviously I'm aware of it being in the space, but I think for anyone who is interested, it's another area of public health that people may not be aware of. So maybe, you've spoken somewhat about it, but maybe if you can unpack exactly what the training is like. I know in South Africa, it is done through our National Institute for Communicable Diseases. So there is that program in South Africa as well. So it would be beneficial for anyone watching to maybe hear a little bit more about what field epi is.
Okay, so just like the name goes, field epi is just epidemiology that is focused on the field. As I said, its origins are from the Americas. We have the CDC. Within the CDC, there was a small part of it called the EIS. The EIS is the Epidemic Intelligence Service. So it's a service, it's a military service that looks at epidemics and its potential and war issues. They are there to protect the interest of their citizens. And so part of that is to have the military having an epidemiology wing that looks at diseases and their potential for warfare. So even the sign, if you look at the logo, it's usually a logo of a shoe sole that is worn, has a hole because somebody's walking around. We usually say health is manufactured at home. And one of the things that the program tries to push people is to go right into the field, as opposed to waiting for the patients in the hospitals. We go right there and do all the health promotion. We do the prevention of disease, and then it's heavy on data and collecting data to inform policy. And not only policy at the government level, but policy also at clinical practice. So it's a program that is, I love it because it gave me the opportunity to have a solid epidemiology background, but then also it's changing. I'm happy the other day I checked, now there are guys who are purely following an NCD track. There was no track for NCD at that time, and I'm an NCD guy, I love that space, but at that time it was difficult to find my space in NCD. So field epi is exactly that, is looking at disease determinants, understanding and diagnosing a community, looking at what ails them, what can they do to have better lives, and how can we, in a more cost-effective way, give them health, by stretching the dollar. So it's health at the community, but with finite resources that you can be able to stretch and make sure that they get the health that they deserve.
Thanks, Joe. I think, I'm glad to hear that it's expanded to NCDs. And as we all know, NCDs is now taking over from communicable diseases, especially in, sub-Saharan Africa as the major burden of disease, and the resources haven't followed that burden of disease. And so we need to catch up basically in terms of NCDs. And I think the point around data, for anyone who's watching, it is something where if you enjoy data, field epi is really interesting, because that's what you do. You collect and analyze data and use that data for decision making. So it's a really interesting, but it's more, as Joe says, more practical in the field, as opposed to, doing formal research and, collecting data in that way. So Joe, now you are at WHO in South Africa, and I know, anyone who is watching this probably is very aware of WHO, and it's a career that many people do aspire to work in, the international space, to influence decision-making at that level. But I can imagine, as with any career, it's not all glitz and glam. You actually have to do the work. It's not always being at the World Health Assembly. There's a lot that happens prior to the World Health Assembly in actually getting ready and understanding, as you say, lots of reading and engaging with ideas. So maybe if you can describe a little bit more about, working at the WHO, what are some of the, types of work? As you say, you're supporting the National Department a lot in terms of NCDs and mental health, but I think it's one of the organizations that people don't really understand unless you are working in the WHO. And so it would be great if you can articulate a little bit about, what it is that you enjoy about the space as well.
Okay, I'll take one step back and look at how the field epi prepared me for this, because when I reflect on my journey, I really thank God that happened. I think it was in the AFNET. AFNET is a group of the field epis within Africa, a network of those. We had an AFNET conference in Amman in Jordan, and I can't remember the gentleman who was speaking at that time, and he was a the keynote speaker, and was trying to talk about who is an epidemiologist, or what are you supposed to be as an epidemiologist in this age. And he had 4 characteristics of an epidemiologist. I'll just talk about 2 today, which have really worked for me. The first one is that an epidemiologist, or public health practitioner, if I may say, is supposed to be a magician. I didn't understand how a magician is supposed to, and how we are related. But now within WHO, I have come to understand what he meant by being a magician, because there's a problem with health. For example, in there's cholera in Hammaskral in South Africa. Oh, there is monkeypox, one case has been discovered. Oh, there is, the first point of call is the WHO. Guys, we have cholera in Hammaskral. Now, the magician comes in here because you have to be able to think in a structured way to help you have to pull a rabbit out of a hat. Literally, you know, because you have to think on your feet, because the government, and remember the structure of the WHO, now that you've asked me about WHO, the WHO is a member state organization. So we are like a secretariat, like a CEO of a board, if you may. So the board makes decisions and says, you, WHO, the CEO, implement this. So we sometimes don't have originative, or I would call it, I don't know how I would call it. We normally don't generate our own. We respond to what member states tell us. They say, okay, NCD is becoming a problem. Can you help develop an NCD global action plan? And we go into work. Then we present it to the ministry. We cannot develop a policy for the ministry. So the ministry picks our document and we again help facilitate. We are more of catalysts than participating in itself. You know, sometimes during COVID, we were really blamed for many things. What is the WHO doing? You know, and it's out of not understanding that WHO is a member state. The member states are our bosses. You know, they tell us what to do. We are a secretariat. And of course, we have the job of looking for evidence and packaging it in an easier way to make it easier for member states. And we also set standards. So in that way, yes, we deserve that harassment. But when you understand the role of WHO, then you come to appreciate what they are, and more importantly, what they are not. I've talked about being a magician. The second one is the most important one, and is the one I want to talk about, is a ventriloquist. A ventriloquist, let me explain what a ventriloquist is. If you remember when you were young, there were puppet shows and you would see somebody with a barrier somewhere, then somebody is wearing a socks in his hand and he's saying, hello, Atia, how are you? So that guy who is moving the puppet is called a ventriloquist. So a ventriloquist can take any form. He can say, okay, I am a small little bunny and I'm saying, hey, Merry Christmas, you know? So I consider myself a ventriloquist because I have the knowledge, I have the solutions, but my mouth is not as big as, for example, the Minister of Health in South Africa or the Director of NCDs in South Africa. So I package it for him and I move his lips. I'm contented with just being a ventriloquist because for health to change, I don't have the mandate in the country. As much as I might be very knowledgeable and I know exactly what to do, it's not my space. My space is to package it and to help the government to be able to do 1, 2, 3. So as an epidemiologist, I sometimes take a backseat. You know, one would wonder, then it must be a boring place to just package things for others and they shine. Oh yeah, the beauty of it is I sometimes drove the example when I was working in the Ministry of Health in Kenya. I would write the speech for maybe the president or the Minister of Health. And we are in this great meeting, they are launching, I don't know, UHC, and there's a lot of pomp and color. I'm seated right at the back, nobody even knows me. But as those words are said, I'm like, those are my words. And occasionally, let me be careful on how I say this. You insert words in those speeches that are not wrong, but you make sure that those words will come to be seminal, because the president said we are committed to installing UHC, for example. You could still have said it in a way that over time or in many years we will, but you said this government is committed. And that is the word that the president said. And remember, words like those become policy. So my boss and everybody else is supposed to follow in line from the words of the president, but they are not the words of the president. They are the words of the ventriloquist. Anyway, so just to put it that way. So a WHO is a beautiful working place, I must say. But I must hasten to add that just like any other working place, it has its highs and its lows. It's not the best paying job. I think I could be like you, Atia, working I don't know where and earning money and having great holidays. There's a huge dose of service and sacrifice working for WHO. And I love it that is the part that keeps me going. Every time when I go to sleep and I look back and I see that I influence the health of a population, that I help to secure the health of the coming generation, that keeps me going. It's not the worst paying job, of course, but I think there's much more sacrifice and service, if you understand what I mean. Now, One, and I looked at the question that you have asked me before, and I might just go into it and talk to this young budding epidemiologist or young medical student or young master student who's just wondering now where to start. How do I get into this public health space? Because when you're in medical practice, sometimes you imagine the public health guys are having it easy. It's just meetings and they're paid in dollars. And here I'm struggling with obstructed shoulders in gynae, and I don't know, a ruptured abdomen. You know, you would imagine that is all rosy out there in public health. To some extent, yes. But there's a lot that is required from you. To whom much is given, much is expected, and a lot is expected from us. So the very first thing I would say for somebody considering a career in public health, the first thing is to be willing to give the extra mile. Greatness lies at the edge of your comfort zone in public health. There's a lot of sacrifice and a lot of service rather than just being an international staff or you earning a lot. Oh my, a lot of it, people will never tell you, and I'm sure you mentioned it when you started, that you work for it. And it's gratifying because whatever you plan, there's maybe money to implement it, and the results come, and you feel that your knowledge and your time and your passion has changed something in the realm of global health. The next thing that one needs to do within the space of global health or public health or international health, all these which fall under the purview of public health, is to network and network and network. I think your network is your net worth, as they say. I usually tell young epidemiologists, budding global health experts or public health, I ask, for example, at Tinder, do you have a business card? They're like, oh, why? I don't even have a name to myself. Why? Just write your name, a TM and your number and email. It's enough. It's a bridge to create a network. I always give the example. I told you I got an award one time in New York during the United Nations General Assembly for work we are doing under SDGs in NCDs. So when we were in New York, that time during the United General Assembly meeting, my goodness, is usually everybody's there. Presidents are here to talk, ministers of health. So it was a very busy meeting. And in one meeting I attended, I can't remember, it was one of the side meetings, I think, I met with Mayor Bloomberg. I think I talked in one meeting and he just came to say, hi, thank you, young man. I like the position you took, the usual small talk after a talk. And he was being whisked to another meeting and he said, do you have your card? Where I was like you at here saying, why would I need a card? I mean, I can always tell the guy, 071, he's not there. And that's an opportunity I lost, which I was like, oh my goodness. So a card is not a thing that packages who you are or shows how. No, it's just a bridge to create a network for advocacy tomorrow. I also have met with people who are looking for somebody. For example, we're looking for somebody who can do 1, 2, 3. And I'm like, so I remember some guy and I'm like, this must be a TS. But then I look all my cards, like every time I pick cards, I always package them and put them here. I went through all my cards. I'm like, oh my goodness. I tried to call people. Nobody seemed to, and I know this is a tier. But unfortunately, a tier doesn't have a business card or an email or a way to be reached. So the first thing is harness your networks, have this card that you can be able to present. The next thing is boldness at here. Within public health, there's a measured space between being obnoxious and disruptive, but also being bold. In my community, I speak Swahili. There's a word that is called kiherehere. Kiherehere is, this child who is like, young man, just sit down, be still, So we say this boy has kiherehere. As we grew up, kiherehere was a vice. And our parents would just look at you with one eye and tell you, young man. But I realized today that was not right. We needed to have harnessed that because it's a skill. I remember a young man in my school in Starehe at that time. This guy was called Martin and he had a lot of kiherehere. So visitors came to our school from around Square. My school was around Square School. So some visitors from Australia came to our school and they were visiting and the teachers were just asking questions. And we were told, anybody with a question. And this Martin and this Kere asked, I like your new uniform. I like the way you guys are looking. How would it be for somebody to visit your school? They said, you want to visit? There it is. So me inside here, I'm saying, why couldn't I say that? So you have to you're saying it respectfully, but be bold, just go for it, ask for it, because there are many things in public health space that will never be given on a silver platter. Never. You just have to ask. You can ask, oh, I see you have a consortium that is dealing with HIV and I've been working this. Can I? And they're like, why not? So the worst they can say is no anyway, which you are expecting. But what if they say yes? So many things you have always to be bold. I have many examples of where I think this has worked for me. I told you the story, and you'll have to cut many things from this at here because I am speaking on and on and on. When I was doing my course in the University of London, there was a form that we had to sign because it was a distant learning to say that you have money to pay for this course and the university is here to teach, you pay for the modules, and I signed it. By the time I remained with, I think, 4 units, I had no money. I had taken a bank loan to finance this. This is the best bank loan I have ever done. You know, most of the bank loans we take to buy land or houses, but this one I took to build my public health career. So I've run out of money. I wrote to the Dean of Students an email in the University of Dallas saying, please, and of course, you know, in Africa, we use that line, I'm from a poor background. I am, you know, if you can help, I only have 4 units to remain. And I don't even think she read the email. She said, I know, and I'm sure you read and you have signed our form saying the university does not give direct bursaries, but I will even give you an attachment of many, many places you can look for, the chevening, I don't know, scholarships, or all those, there's usually a list. But the worst thing, if you've ever tried that here, is to look for a scholarship when you're an ongoing student. It's very difficult for these scholars because they know you started. They're looking for somebody who is in trouble. So I applied everywhere in that form. And it was difficult to justify. Why would you be looking for money for a premium? Because that time I was earning a little more money from the UNHCR and adding with my loan. So they're wondering, why would you be? So I didn't get, the long short of the story is that I didn't get any scholarship. So I went back to the same dean of students and said, please help me if I can. She even called me. She didn't even say, Joseph, please do not, there's nothing we can do. I called her boss, the dean of the school. I wrote an email to the dean of the school. And the dean of the school forwarded the email to the dean of students. And the lady again called me and said, Joseph, I thought we talked about why are you talking to the dean, please desist. Now you can see the tone is starting to become a bit harsh. I rewrote to the dean again, this time pretending to be saying, sorry, I wrote you an email and it looks like it went to the dean of students and I'm sorry, but in case you see somewhere, please help me out. And they didn't come back to me for like a month. This time I went to the internet. The internet is a good source. I looked for the email of the chancellor of the university. This was there. And I wrote the email and my goodness, of course, you know, it goes back to the dean of students. This same lady again calls me and says, what are you trying? The long and short of it, again, I reply with an apology. But 2 weeks later, I noticed on my student portal, those courses have opened up. Like, what has happened? Then I think the dean said, we are doing this on an exceptional, we don't do this, but young man, just finish your course and get out of here. So one of the things I'm talking about is about boldness, but measured boldness. Boldness that does not, you know, you can be too obnoxious, but you have to be bold in public health. The next thing is express yourself. You know, in clinical practice, we have what we call evidence-based medicine, and actually in public health is where I find evidence-based medicine. In clinical practice, sometimes we have evidence-based practice. The big doctor sometimes doesn't even have the evidence, but when he says something, I'm sure you know, when we were doing ward rounds, a guy says something, and because it's so and so, maybe we have even read a book that says that thing he's saying is dangerous, but well, he's the guy. So evidence-based practice. But in public health, we rely a lot on evidence. So package yourself with evidence. You're more listened to when you have substance, when you're talking, when you stand. And especially as a young person like myself and you at here, when you go to a meeting, first things first, package yourself. Wear well when you're making a speech or something, so that these fellas don't start judging you from clothing. Let them judge you on the content of it. Because sometimes, one thing I'm very careful on is when I have to go to a big meeting, because I'm a small man, I'm from Africa, and all these things are things that get in the way of you express. You know what you're supposed to say, but as you look at the crowd, there are all these barriers that are flying between. What is he wearing? What is this guy going to say? He looks even scared. Or so remove that and let the only thing that is between you and them be what is up here. So express yourself, package yourself. Remember, as you mentioned, that here is we're living in very lucky times. You can get a degree from Coursera. You don't have to go to a formal university. You can literally learn outside on the internet. We have so much time out there that we waste on, and let me not call it waste, it's necessary, but there's so much time that you can spend to enlighten yourself. Take a course. Every quarter of a year, you should do a course. It doesn't have to be even in your space, like epidemiology of hypertension. No, even a course on how to cook pap. It's not a waste. It adds onto your general knowledge. The next thing is don't compete. There's a lot of competition in the space of public health. I don't know why people thought competition. The best thing that you can do, nobody can beat you at being yourself. So just be yourself. This is what I have. This is what I'm made of. Okay? Because sometimes when you get into the competition, you have enemies who are not enemies. You don't even know why you're fighting, but there's some enmity that has brewed. Then be flexible. A lot of young people want to be the CEO before they've be the person who sweeps the floor. Life is incremental, life is organic, and that's how we are created. If today I was made the WHO Director General, I would crumble. I don't have the wherewithal. But progressively, 2, 3, 4 years later, I become head of department. I gained, and then also I have the gravitas. I know how to deal with people. So if they were to promote me today to take Tedros' position, yes, I would take it, but I think it would be crushing me. You get what I mean? I have what it takes up here. I think I can, but I think I need a little more of, here and there, gravitas to be able to take that position. And I should be very flexible. A lot of guys misunderstand the space between slave and service. I use those terms as big as they are, because sometimes you're like, I'm just slaving here. These guys are using me. Look at it as service and you package yourself, because you grow when, I give an example in a department like ours. The boss says, we want somebody to package a policy brief on the NHI. And people look at each other. Then they say, okay, you, Joseph, do it. It looks like, my goodness, why me now? But in the process of packaging that thing, here I know you know what I'm talking about. You start becoming the ahead of the pack, not because you went to school, but at one time they will say, we need somebody to talk about NHI in WHO, and they'll say, hey, if it's not Joseph, I think Joseph is the one who understands. It came natural. You don't have to fight for it. They say, this is Joseph's space. It was not my space until I was thrown in the deep end in the form of slaving, but in the process, I package myself. So accept to serve in the interim, because that service empowers you. That service packages you for a rainy day. The next thing is stickability. I will talk about stickability here, because most of the young people, you are working in Chai for 2 months, you jump into, I don't know, you hear another position, and you are qualified for all these positions. But after a while, that pattern works against you instead of working for you, because a rolling stone gathers no moss. I'm not saying you stick into a place for 10, 20 years. No. You have to have ambition, but also hurry a little to know exactly what was being done there. When you have your CV and you've been in 20 organizations, it's not a plus. I think it's even a weakness, because in a span of 4 years, how can you have worked for 10 organizations? It's possible. I'm not refusing. But me as a person who is hiring, I'm a human being, and I'm influenced by logic. And I'm like, okay, must be a very competitive guy to have, but there must be a reason why you don't stay. So a little stickability works, so that you also know what's happening there. And then, of course, the last one I would say is this having that grit, and I've mentioned the boldness to just don't apologize, because most of us, especially in Afro, we start our sentences with sorry. Why are you apologizing? When you are seated around a table, it is by merit that you find yourself there, unless whatever. So when you speak, be respectful and say what you know, and don't apologize for it, as long as it's right and it's not insulting anybody. Most of us have a beautiful point, but the way you're putting it, you're apologizing. Then another fella picks that point, packages in a different way, and that meeting, when it ends, it's no longer your point. It's that other guy. So please stand up every time when you're feeling, tell yourself, look up. say what you know, because that's who you are, and don't apologize for it. Be watchful. Don't annoy people. I mean, but say what you must say. Of course, before I finish on this long thing that I'm talking about here, let me talk about three things that present a challenge. Where do I start? Do I get so broad in public health, or do I just look for this niche and follow it up? I don't know what I would say, but I would say life is very organized. You cannot have an inverted pyramid and it stands. The most stable pyramid is the one that has a wide base and then goes up, 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 up. If you have a pyramid that looks just like this, it's also unstable. So start wide, just like everybody else. You started as a medical doctor, you can start as a biologist, you can start as a whatever. You don't have to be a doctor to be the best epidemiologist or public health space out there, but you have your base. That base is where you always go back to. I always go back to my medical practice and I draw my examples and bring them up. And as for example, now I went into global health, and not only global health, NCD space, but now I'm starting to think, maybe I should widen it a little. My current thinking is to be able to package this public health and NCDs as development. Remember, health is three things. It's an indicator of sustainable development. It is an outcome of sustainable development, and is also a prerequisite. There is no development without health. Health is a measure of development, and health also helps to propagate development. But we in the health space are not able to package these things of ours in the language of development. That's why we are not able to attract resources. So maybe that's in our next frontier. So the thing I'm saying is, have a broad base, then work towards a crescendo where you might be that niche. For example, Atia, we're looking for a medical writer. For all intents and purposes, I'll think of Atia. There might be thousands of them in South Africa, but because I worked with you and you did a great job, you have a niche where it pushes you, it gives you an edge. Even if I'm looking for a consultant, I'll be biased. I'll say, let's work with Atia, I've worked with her. So start broad, but then work towards a niche. Always have a space where you can say, I don't compete here. Yes, don't get too comfortable, because if you're not competing, then know that you're either too lazy or there's no one interested in that space. That's one. Then two, money versus the satisfaction. It's a legitimate question. I want a job that I am a P5, P6. I want to earn all this money. Money follows ideas, and it takes time sometimes, and you have to grow into it. So work on your passion, and the money will follow. Work on, be there, do the job. Don't focus so much. Of course, you must. You can't just take another job. You have family, and my mom used to say, passion is not the best meal for dinner for your children. This passion of me in public health will not pay my school fees. If I go to Checkers, there's never a line for those who have a lot of passion. No. All of us have to pay. So watch that the passion doesn't consume you. But that passion, harness it, and let the money follow after that. And then the final one is the question of, do I stay local? Do I go international? I have the blessing of having had both. And the both extremes have their blessing. There are things I stay here in South Africa, I'm like, oh my goodness, I should go back home in Kenya because of the blessings that were there while working as a local. But then there are things I look here and I'm like, hey, thank God I'm here because of the opportunities that present as being international. One of the downsides of being international is a very lonely space. I stay for months without meeting family, without meeting friends. With a weekend, I can just be there, staying, wondering what to do. On the plus, also, I have never spent as much time with my wife and children as I have today. When we were in Kenya, there were all those distractions. I don't know, we'll meet in the evening. Sometimes the whole weekend, each of us is on their own corner. But God has a way of just bringing you two guys together. These days, I spend so much time with my wife. I'm like, oh my goodness. And we, anyway, I hope you know what I mean. So each of them has their own beautiful side. The international health space has more money, but it's a bit lonely. The local, very well paying. For WHO, I must say, I think everybody should work for the WHO, not because I work there and I'm biased, but the beauty about WHO, it helps you to understand health in a raw form, when there are no interest, when there are no, it's just health. And your interest is just health, and to see the smile of a baby and to see healthy people. There are no, sometimes you work for these NGOs who have an interest, or they have a grant that it must go this way. For WHO, what amazes me is that from morning to evening, what moves me is the health of the populations. It's not to satisfy a donor, it's not to satisfy, it's just to make sure that the populations are healthy. I'm not saying that everybody must, not everybody can, but if you can, there is a shortcut to it for the young public health professionals. And I would say volunteerism is very closely linked to public health. My wife works for the UNV program, that is the United Nations Volunteers. And sometimes you don't have to work for the UN, but you can volunteer your time. You can volunteer your knowledge. You can volunteer your expertise to the UN for the service of mankind. So it's a very formal program. You can say, I'm taking a long study leave or a long sabbatical for 2 years, and I want to just be at the service of the UN, and they'll find something for you to do. You go to their website. There are many places. For example, currently the world is hemorrhaging in Gaza, in wherever, what is it called? In Russia, wherever. There's a lot of space. There are a lot of children that are suffering out there, and you don't have to work for the UN, but you can volunteer for the UN. And after you have been a volunteer, it's very easy then to fit into the UN, because you are halfway there. You are halfway there, and it becomes easier to join. I think I've said so much things, Zatia, so I ask the questions now.
Thank you, Joe. I think that was a really, I particularly enjoyed hearing your reflections for the, emerging colleagues. I want to just pick up on a few things. I think to your point around, you can't just be the head of the WHO or the Minister of Health. And I think your reflection around how field epi translated into where you are now is really useful, because and as you say, sometimes you do things you don't really know the path, or it doesn't seem like it's related to anything that you're going to be doing, but you pull on those skills and later utilize them somehow. And it's not always just knowledge. It is sometimes what we quote unquote say softer skills, things that you learn engaging with people, how to handle difficult conversations, the process of engaging different stakeholders. And I think, as you say, you could be the head of the WHO if you were appointed, but there's some of that nuance that you need to actually go through different spaces to be able to handle. To the point around salary, I think that's a really good reflection. In general, in public health, if you want to be really rich, then maybe clinical medicine is the way to be. Not to say that you will be poor. I don't think any doctor is not paid well, but you're definitely not going to be excessively rich in public health. You will survive, you will have enough money, but again, you do it, and a lot of people do it for the passion and for, as you say, the service of the global community of populations and patients. And it's that's the sort of some of the decisions that you have to weigh up and be aware of. And I just want to say, I really love your points around being bold, and thank you for the stories. This, around. I don't have a business card, Joe. I will go and get a business card. Post it. Yeah, but yeah, I think all of your reflections around being bold, speaking up, being able to, even just the volunteering, a lot of the opportunities that I've had have come from volunteer spaces. And so, putting yourself out there, I know because health is not seen as a business in a way, sometimes people think, oh, if I have a business card, or if I put my stuff out on LinkedIn, people are going to think, oh, I'm doing this big marketing exercise. And it's not that, it's about, again, to your point around networks, it's about sharing what you're doing, having people be aware of what you're doing. And then it also helps us to collaborate, because a lot of times we do things in silos and no one is aware. And then there's two projects doing the same thing, where you could have actually just collaborated. So I think to the younger or emerging colleagues, that is a really valuable advice about articulating what you know. I'm sure we've all sat in conferences and meetings where you wanted to make a point and you thought, this is a really basic point, and then you don't say it, and then somebody else says it, and people are like, yes, that's a really good point.
True.
And so, these things don't come naturally. You have to practice them. But I think, Joe, those were really, really great reflections. I can't reflect on all of them. There were so many, but I would suggest that if you, I don't know when you're going to find the time, but if you do have the time, write these out for people. I think the colleagues out there will, if they, some people consume media very differently. Some people would like to read, but if they, and some people would like rather to watch a video. But I really thank you for those.
I'll be glad when you're through to get a transcript of the same. So I'm thinking of writing a book, not because we don't write books because we have something to share. We write books because what we have might be useful for somebody, maybe one or two. So if you think this would be useful for somebody, yes, I would want to scribble it into some book. So maybe we can and agree. This is how networks happen, because I might not have the skills to write or the patience or the time, but here you probably are able to package it into something. Even if you go to my LinkedIn page, I just update when I have a new job, and that's it. For 3 years, it stays the same. And here you're able to put more content into LinkedIn. We all are enabled differentially. So let's see how this goes.
Yeah, awesome. I'd be happy to. And like you say, there is a transcript, so we can figure out how to use the transcript. Thank you. This has been really great. You've covered everything that I've asked for. Any last words before we close off?
Just that the background you're seeing here is the WHO at 75. I put it half time to remove it, so I'm just putting it out there. I work for the WHO, and this clip might be in the public space, in your platform. I have no problem with you tagging them, or I'm proud to work for WHO. That I must put out there. I love it here, and if this might help somebody, I'm sure that is why we exist as WHO, especially for younger doctors. One of the challenges, and here you got me speaking at it. One of the challenges that I've seen, and I need to challenge our political leaders, especially in Africa. I don't think Africa loves its youth. They don't. We have so much capacity in the younger generation, Atia, that struggle so much to participate in nation building, to give what they know and what they can do. And I don't think that space is actively provided. You find you really have to struggle. Why you see some people very embittered in some position is because it took them grit to get to where they were, And I like when I give my story, because all these stories I've given at here, there's always a person who gives a ladder. You could be in some position somewhere where it doesn't cost you anything. For example, you know me at here, we are friends, so it doesn't cost me anything to sharing these thoughts. But this might be a ladder to somebody, even to yourself, to packaging your profile on LinkedIn or wherever. Some of the jobs and some of the positions I got, it's somebody who gave me a ladder. They didn't have to, but that is the role of mentorship. And once I have been blessed by somebody, it's my duty to bless another person. But I think we need to make at least our political leaders to understand. When I was growing up, and still I have those dreams. I don't have the gravitas to go into the constituency and ask for votes to be a member of parliament. I'd love to sit in the health committee in my parliament, in my country's parliament, because it pains me of what potential we have as countries in Africa and what I have and has gained internationally. And I would want to give back, but I can tell you, the road to that committee is a tough one. But if I was to be nominated, and I know my president listens to LinkedIn anyway, this is a joke. Where do you find these opportunities? Unless you know somebody who extends a ladder. So all I'm trying to say is that mentorship works. I have been mentored by great guys and I love it. Let me just mention one of them. Somebody said, I thank my father for life, but I also thank my mentors for living well, because mentors are the ones who join those dots. They see the skill in you. They don't have to. They're just living their lives, but they know, there's this job. Joseph, please apply for it. I am also mentoring some young guys behind me, and I don't have to. I can just live my life, but only to remember that mentorship has to cost you. There's a difference between mentorship and supervision. There are guys I'm supervising and I'm not mentoring them. There are guys, mentorship has to cost me. I can't be mentoring somebody who I don't even know the name of their children. I don't know what they're struggling with. Mentorship is active, it's not passive. Supervision can be passive because did you come to work at 8? Okay. Did you present the report? That's supervision. But mentorship is beyond that. It's about what are you struggling with? What's the next step in your career? What do you think of doing? Let's talk about it. Every Thursday, second Thursday of the month, let's just meet and drink a drink and talk and hear what are you struggling with? Oh, what are your plans for? That is mentorship. It's passive. It's very active. Okay. So I would push the challenge out, and maybe we can talk about it one time on mentorship in public health, because the problem out there is that there are many guys who have positions and they have ladders that they can give others, and they do not mentor. Every time you go to a funeral and they say, oh, this guy left a very big gap, I don't know, very big shoes, I don't know who will fill that. That's a failure. It's not a success. You should not be proud when you leave a gap. Why are you leaving a gap? You should mentor other people. When you exit the stage, this world is a cycle, you know? So when you exit a stage and nobody can be able to point out to somebody who you imparted knowledge and imparted yourself, mentorship is pouring yourself into the next generation. And that's how you immortalize yourself. So some people just hold on to what they have very violently, and you know, they leave and the world will go on, but what are you remembered for? So there are some two books I would want to recommend guys to read while we are at it, now that you have not asked me. One of the challenges in public health and in medical practice is that we are challenged. Oh, you guys are employed, entrepreneurship. I don't know if you've been in a space with some entrepreneurs who look at us like we are fools. You just want to be injected with this thing called salary at the end of the month for many years. And it's legitimate and I accept it. And yep. But we should also try to be mentorship. There's a book called The 10% Entrepreneur. You should read it because it tries to understand us who, for example, I'm here in South Africa, I earn a little money. Back home, I try and do a little business. 10% of my time, maybe I grow it slowly. It's not an all or none. It's not like you are either an entrepreneur or no. You can have, so people in public health or in clinical practice, nobody ever teaches us these skills when we are medical students or we just live for the day. And I think some skills need to be taught to us, or we need to be woke and just, learn about it. So you can be a 10% entrepreneur as a clinician, save a little, think about your older age, put a little small business that works you on the side, not taking away from your employer. 10% is time you can be able to squeeze out of the time that you waste around. That's one book. The next book is, I probably don't want to mention it. It has the worst title out there. I'm sure you know the book I'm talking about, but it's a beautiful book. Have you read the book, The Subtle Art of Not Giving a whatever?
Yes.
It's a beautiful book. I don't know, well, that was the reason they gave it a crazy name. But when you read that, I've never read a book nonstop. From Heathrow, by the time I arrived in Nairobi, I'd finished the book. And, well, I wish they would call it otherwise, but I wish they would maintain that name. It's a beautiful book. Anyway, we've talked a lot, Atia. I think it's time to go.
Thank you, Joe. I think this has been really, really great. Definitely will reach out around putting this into a written form, and we can publish that as well. But thank you for all of your reflections, for the stories. I can see why you and I are friends. We both like stories. And I think it just helps people to understand that there are human beings that are doing all of this work, and we all deal with similar challenges, and there is much that we can learn from each other's journey. So thank you so much again, and looking forward to seeing what you do next.